Dr. David Grace, we appreciate your time this morning. We've arrived at Labor Day weekend, and we know that holidays haven't necessarily been good for what you're trying to do, which is stop people from getting and spreading COVID-19. Do you think Labor Day is going to be different?
A great question. And I think my answer is it depends on choices that we all as New Mexicans make for the holiday. One of my mentors once said to me, good judgment comes from experience and experience comes from bad judgment. And I think hopefully we've garnered some experience about what happens in New Mexico with large gatherings and on holiday weekends. Families have a hard time staying apart on holidays. We get that. People drive in from all over, sometimes other states to celebrate and have a big party. But as I don't really like to say, there are just some things that we have to give up for a year, and big family gatherings probably going to be one of them. Now, people you live with, and now with the limit of 10, there's probably room for a few small guests. But in general, we really need to keep those groups small and follow the other social distancing guidelines that I think will help us to keep that spread down over this Labor Day weekend. The other thing that's really important that I want to emphasize is we are reopening schools, and that's really important. That's a big investment. And I can't think of a better time to stay home with a small group of people like the ones you live with for your Labor Day barbecue than now, because we simply don't want to tip over that apple cart and cause our communities to be unsafe for kids to return to school.
Sure, there seems to be a lot that's stacking up right now, as you said, with holidays and kids getting back. You spend what seems to be a fair amount of time, along with your medical team, synthesizing studies on COVID-19. As we go into this next month, what has your eye?
I think what's had my eye and all my time this past week is working with Ryan Stewart, the Secretary of Education, on the detailed planning of return to school. There's hundreds and hundreds of decisions to be made, and some of them are super easy, like, yeah, everybody has to wear a mask, but then some of them are really hard, like, what about kids due to medical diagnoses or a variety of limitations simply can't wear a mask, and what's our approach going to be to that? I wouldn't have thought that lunchtime would be an area that I would have spent 8 hours on this past week, but it's a big risk. It's kids inside without masks on for a period of time for lunch. One thing we've learned about this through the help of our partners at Los Alamos National Lab is cohorting is a really, really big deal. So safely reopening schools, we want those kids in that class to be with each other and no one else. So hallways. And so there's a lot of detailed discussions. My heart goes out to Secretary Stewart, because in addition to the ones that have some medical connection, he's got thousands of other little details he's working through as well. So I think parents keeping their home safe through Labor Day weekend will keep our community safe through Labor Day weekend, which will reduce the likelihood that our K through 5 or 6 graders will be bringing COVID into the schools. Same for teachers, them staying safe reduces that likelihood. I think if anybody can do it, New Mexico can do it. We've got a good shot at successfully reopening schools. Our numbers are where they need to be. Everybody's reading about states where there were disasters like Georgia and Mississippi and Alabama and Oklahoma and Indiana. All of those folks were experiencing case counts 1.5 to 4 times higher than New Mexico. If they'd had our gating criteria, they never would have opened. So I think we're in a good place, but let's preserve that position, being poised for success by safe Labor Day weekend practices.
In those meetings with your team and with Secretary Stewart, I'm sure there's someone who says it's really important for parents to be able to get kids back into school, not just for kids, but for parents as well. Are those conversations taking place, and how does that fit into it?
Absolutely. I think I've been saying all along, and we've been saying that we have to learn to live in a COVID positive world. And that includes balancing control of the disease, and life as best as we possibly can with things like school and businesses and all. Unfortunately, we normally function up here, but the disease has brought us way down. We want to try to find that exact balance. But hey, I got a teenager. Chad Smeltzer, our lead epidemiologist, has a couple teenagers. So we're personally aware of the value of children returning to school. I'm completely convinced by the educational research that shows that in-person learning is better. And what we're doing here is really just taking baby steps, starting with the elementary school age kids whom our modeling say pose the least risk, half time in school, and then further expanding beyond that. People have been bugging me a lot lately, like what could be the possible difference between high school students and elementary school students? And, they're all kids. How can you say they're different? Well, the answer is that elementary school kids go to school and they come home and they have, at least in these times, very limited interactions with other people outside their classroom cohort and their family. Middle school students may be more likely to gather in a place they can walk to. And I think we bumped up their interactive, index by 10 or 15%, but high school, 20 to 30% higher number of interactions outside of school. And so there really is science behind this. It's true that we're trying to predict the future, but I think, we're basically trying to figure out what's going to happen 2 to 4 weeks from now. Other states are just doing stuff and then waiting 4 weeks to see what happens. So I like to think we're 6 to 8 weeks ahead of what other states are doing, and using our analytics skills and tremendous partners across the state. Presbyterian's been a gem as well to give us a better idea of what to expect.
Sure. You've talked previously about not getting rattled by a couple of days of case counts in the high hundreds or 200s, and how positivity rate can better inform us. Can you spend just a moment explaining how those two things fit together?
Yeah, let me take you really briefly, if that's okay, to our website. I've just decided it's easier than making slides all the time. But sure. Here's our website, and actually it starts at the opening page. If you just Google this or any version of this, you'll get right to this page. And then you can see we have 4 categories. How is COVID spreading? How are we doing with testing? How's our contact tracing doing? What about our statewide healthcare system capacity? How are they doing? And everything is looking good. Last week, we only had one measure out of line, was the getting people into quarantine. And this is late breaking news, but you're the first to hear it. But that one also is in line this week. And we're sort of meeting all 8 of the measures for our 4 categories. But what we're finding is this daily cases is an important new addition. We can measure that by for the whole state, which we have here. And these are familiar to your viewers and listeners, these various peaks, but we're now down in a really good range and where we do have room to actually reopen. And then the case positivity rate, I'm going to go to next. We're one of the best in the country. And I think you've heard me say recently that if you want to find a state that's doing better than New Mexico, you won't find it going west of us. And you have to go all the way to West Virginia to find a state that's doing better than us east of us. It's them and the New England states. So this test positivity where lower is better is doing great. And our tests, even though they've come down a little bit, this is due to a number of changes, including more focused testing on counties where we're seeing higher case counts and higher test positivity rates, which, as you know, are going to be used to inform decisions about returning to school. And then the other thing you said is really important. I get a lot of emails about case counts per day, each day. And I send them back saying, I don't really look at those. Try to focus on 7-day rolling averages. It gives you a much better sense of trend. We know that case counts are going to be lower after the weekends when less testing occurs on weekends, and so this rolling average smooths that out and keeps us from overreacting or underreacting to a single data point from a single day. That being said, we're seeing really nice low case rates, even some double digits instead of triple digit rates recently. And I think that makes me feel comfortable and our epidemiologists feel comfortable that we do have room for the school reopening here.
We're heading into fall allergy season and flu season. Symptomatically, those are both things that can look like COVID-19. Is it going to get harder to tell who has or might have COVID-19?
Yeah, I think on the allergy side, I have allergies. And so I'm familiar with, itchy eyes is a little bit more consistent with allergies, dry, itchy skin. But and of course, you don't get fever with an allergies. You can get a cough if you have asthma. So as a clinician, those are the things I look at. But flu and influenza and coronavirus, I think are going to be very difficult to differentiate. I know in talking to our laboratory partners and our state lab, they're looking at adding COVID in some fashion to the standard respiratory panel you and I would get if we went to an urgent care complaining of respiratory symptoms. So hopefully they'll be testing for influenza A and B and Haemophilus influenza, which is something different, and other kind of viruses, adenovirus, and then coronavirus as well. So they're working out the details on that and whether they'll do it all in one block or whether it'll be sequential. But we have to build that in order to know what's going on this fall. And as the opportunity to give another free commercial, please get your flu vaccine.
That was my next
opportunity question. To give a free commercial. Please get your flu vaccine in September now or in October, because that will help us.
And I would imagine it would help you, the individual who's getting the flu vaccine as well. And that really was my next question, was that's the difference, right, between COVID-19 and the flu, is that we have a vaccine for seasonal flu. Can you spend a moment going over some territory that you've gone over before, I'm sure, which is the flu vaccine, and is it safe?
The flu vaccine has been shown to be highly effective in preventing influenza. And by highly, people are hearing 100%, but it's more like 60 to 70% in most years. We start with Australia in the Southern Hemisphere and other Southern Hemisphere countries to predict what strains of the flu will be spreading across the world. Generally, manufacturers pick the top 3 of those and build them into a vaccine. Sometimes they're correct. Mostly they're correct. Sometimes they're wrong. I actually isolated a new influenza virus when I was a primary care practitioner in Ann Arbor. It was called influenza Ann Arbor. I washed it out of someone's nose. Our laboratory isolated it as a new strain, and it actually was named influenza Ann Arbor, and it ended up being in a vaccine a couple years hence. If you Google it, you won't find my vital role in washing that person's nose out. But I like to brag about that when I can't think of anything else to talk about. So I get the vaccine every year. Healthcare workers are required to get the vaccine. Like COVID, you can spread influenza for 48 hours before you have any symptoms at all, which is why healthcare workers are generally required to have it. I think a lot of delivery systems will say either you have to get the vaccine or you have to wear a mask from November through March. And so very high uptake in healthcare workers. And I think that's a good barometer. I think if healthcare workers, anything that healthcare workers are willing to do in high numbers should be a signal to the general public that this is safe and effective. Now, people could argue, well, yeah, but healthcare workers are getting it because they have to for their jobs. But also healthcare workers go into healthcare to help other people, and they are very conscious about their responsibility to not spread disease. So I think that we have not had a major problem with serious side effects in large numbers with a flu vaccine in many, many years, and would encourage all your listeners to get that vaccine.
And last question for you, is part of the difficulty with COVID-19 and getting people to understand it that they can't see it so much unless they've had a personal experience with it. They don't see what the healthcare providers see.
Yeah, one of the shocks to me as a physician and a scientist working in government, and as the election approaches, and maybe it's not it was a little bit of a shock at first, more of a disappointment, is that we've kind of let some of these basic science issues become politicized. I think we're over the do masks work or not, controversy in general, although there's still a lot of people who don't wear masks. And I'm kind of hoping that one thing we can all come together on is when we have evidence that shows something's effective or helpful, or like we do with masks and reducing spread, like we know about gatherings, like we also know about travel. We know 18-20% of our cases in New Mexico are in some way or another related to travel across state lines, whether it's us going out and coming back or other folks coming in. I think those things are more what I would call facts and not opinions. So the more we can use those to inform our personal decisions, the better.
Excellent. Dr. Scrace, we appreciate your time.
Take care. You have a good day.